Hello everyone, my name is Juan Collado. I'm a licensed insurance agent in the state of New York. And in this video, I want to share some important information for you or maybe your family members that have Medicare and they do not have Medicaid. So, simply put, in 2022, you may not qualify for Medicaid, but in 23, it might be possible for you due to the Medicaid expansion in New York. So here's the details. In 2022 or before, if you are single and have Medicare, you could only get make $934 monthly in order to qualify for full Medicaid. That is changing. In 2023, it will be up to $1,563. And if you're husband and wife, it will go up to $2,106. So that's a big difference, because they're increasing the poverty level for you to qualify for Medicaid. So $934 for single, and now it's gonna be $1,563 plus or minus a few dollars, because this is a projection, not the actual number, but that's what we expect it to be. For husband and wife, 2022 is $1,363 or less. And in 2023, $2,106. What does this mean for you? If you qualify for Medicaid or Medicare Savings Program, QMB, or qualified Medicare beneficiary, that means that Medicaid will pay for your co-payments, deductibles, co-insurance, and you can qualify for a special needs plan that has zero co-payment, sometimes not only for medical and hospital, but also for prescriptions. So this is a big help. A lot of people may not know this, so share this information with your family and friends, because many times I find many people that have been paying for Medicare Part B for many years, and then they find out that they would qualify not to pay for the $170.10 that they charge you for Medicare Part B. But not only that, if you have very expensive medication that you pay $47, $100, or even $500 a month, because sometimes you have some medication that once you go in the donut hole, that dreaded donut hole, it could go up to 25% of the cost, and that could go up dramatically, depends on the medicine that you are taking. So if you qualify for Medicaid or QMB or extra help with medications, then those costs will go down dramatically, and that could be a big life improvement for many seniors with Medicare that have those very expensive medications. Another thing is, if you are over the income of $1,563 or $2,106 for husband and wife, you may still qualify for the Medicare Savings Program QI, or Qualified Individual, which is gonna be up to $2,107 for single person, or $2,838 plus or minus a few dollars for husband and wife. What does that mean for QI? That you will be able to not pay for Medicare Part B. So you get to save $170.10 or $164.80 in 2023. Another thing is, with QI, you may qualify for extra help with the medications. So that could also automatically put you in the extra help category. If you get 100% extra help, the medication cost will go down dramatically for you. And that's, as from experience, many of my clients, that's the biggest problem, that most of their income or most of their expenses is not on doctors, but on their medication that they take in on a monthly basis. Okay, so lastly, I do want to share, so what happens if you do have a lot of health issues and you have very expensive medication, but you are still over the income limit in 2023? You may still legally qualify for Medicaid via a pooled trust. I don't do pooled trust, it's just information that we gather by working with Medicare members for over 15 years. So it is still possible that based on your medical conditions, based on your income, even if you are over the income limit for Medicaid, you may still be able to have a deduction through a pooled trust in order to qualify for Medicaid. And if you need a home aide at your home to take care of you or take care of a family member, it may be possible for you to still do it legally in New York, even though your income is over the limit. So don't give up. If any of you live in New York and have need any information about this, you can call 631-682-3459. But if you are calling about any other, like Medicare Advantage, Medicare Part D, Medicare Supplement in New York, it will have to be 2-hour recorded line, because the new regulation as per Medicare for this 2022 annual election period is that all calls must be recorded. So you could call this number and it will be recorded, and I will have to say a disclaimer that the call will be recorded and that we don't represent every plan in your area, that you can call 1-800-MEDICARE or go to Medicare.gov to see all your options in your area. So the number is 631-865-5048. I will type it down here for you to see it. Share that information with your family and friends if it's not for you. But this is important to share because many people do not know about this yet. I still find many people that they qualify even before 2023 and they did not know anything about it. I could only give you information about Medicare health plan in the state of New York. Even though I am licensed in a few other states, I mostly concentrate in the state of New York, although very soon I might be moving to the state of Florida or Georgia, so then I will be available in those states also. Okay, so let's summarize what we discussed here. So some people with Medicare through retirement or because they are disabled, they may have Medicare but they don't have Medicaid. Remember that Medicare is for everybody that's retired, they worked in the United States more than 10 years and they are legal residents, or they are disabled and after 24 months they may get the Medicare ID card. So Medicare is the red, white, and blue card. Medicaid is for low-income individuals in the state of New York. So remember, the Medicare Savings Program QMB is easier to qualify, even though it still gives you zero co-payments and covers the deductible for you and Medicare Part A and Part B. But they don't have any limit. As of 2023, they will not have any limit on resources. So that's a big difference between the income limit is the same for Medicare, full Medicaid, and QMB, Medicare Savings Program. But the resource limit are still in place for full Medicaid, but they are not in place in 2023 for Medicare Savings Program QMB, or Qualified Medicare Beneficiary. If you are over the income for Medicaid, you may still qualify for Medicare Savings Program QI, or Qualified Individual, which will help you pay for Medicare Part B and also may entitle you to get extra help with your medications. And again, if you are over those income limit, but you have a medical need to have a home attendant or a home aide in your home, you may still be able to legally qualify for Medicaid via a pool trust. Let me know what other topics you would like me to discuss in this channel. I know we haven't posted a video in a long time because I do videos about other things in different channels, but I intend to try to put more videos that I feel are very important for the senior community, because I find so many people that just do not have this information and it could be very important to them and it could cost them a lot of money. So remember to let me know in the comments what topics you would like me to ask, or if you have any questions, any plan specific questions, I will not answer unless it's in the state of New York. Anything about the topics that we discuss here, I could give you some general answers, but you can also call our number 631-682-3459 or our recorded line again, 631-865-5048. Why do you need to call a recorded line? Because new Medicare regulations for 2022-2023 requires that the calls may be recorded for any plan change or anything that could lead to a change in a Medicare Advantage, Medicare Part D, or Medicare supplements. I take that back, not necessarily supplement, but anything that could lead to a plan change for Medicare in the state of New York or anywhere else. Now they require us to record the phone calls, and the reason for that is because many agencies do the wrong thing for the clients. You get phone calls all the time. A lot of clients complain that they get phone calls all the time. Nobody's supposed to call you unless you gave them permission to call you. So if you're getting all these phone calls, when you pick up, ask them, where did you get my permission to call? Because Medicare regulations state that you're not allowed to initiate a call. You are not able to cold call any Medicare members, so please know that. Many times they'll get scared because they know that you know the rules, and then they'll hang up on you. But unfortunately, many times, many of those agencies, many of my clients have been enrolled in a different plan through the phone lines, and they just don't give you enough information to make you aware of what's really happening. Sometimes they don't even check which plan you have versus which plan they're giving you, and they could cause a lot of harm to the senior community. Unfortunately, now we all have to pay for the wrongdoings of other people. And now we have this recording and the scope of appointment form that you must give us permission in writing before we discuss any Medicare health plan. I hope that this information was very helpful for you. Thank you so much. Until next time. Adios.